78 million people. That's the number of Americans in this country that are obese, according to the CDC's latest statistics as of 2008. Webster's defines obesity as a condition in which increased body weight is caused by excessive accumulation of fat. With its rise in numbers over the years, obesity is something that we need to start taking very seriously. Today I'm going to cover the medical implications that can be brought on or worsened by obesity and several different ways we can fight this growing epidemic. Besides being a nuisance on a regular basis with completing daily activities, obesity has been linked to many medical illnesses, the most known being type 2 diabetes. People who are obese or significantly overweight are at the highest risk of getting this type of diabetes. According to Dr. Jeffrey Baer, an MD of internal medicine and advanced care, obesity can cause significant hindrance in the management of type 2 diabetes, many varieties of heart diseases, strokes, cancer, sleep apnea, osteoarthritis, gallbladder problems, and liver diseases. Dr. Baer goes on to state, obese individuals are at a greater risk for developing these problems, and if one should have any of these diseases, obesity makes it more difficult to treat them. You may not be able to see how obesity and heart diseases can be linked. However, overweight people have an increased incidence of heart disease. They are more susceptible to heart attacks, congestive heart failure, sudden cardiac death, and even an abnormal heart rhythm. Obesity or being significantly overweight is not something you have to live with. You can fight back and win this battle or make changes in your life now before this becomes an issue. There are three popular ways of fighting obesity: diet and exercise, which is the most popular and recommended, surgical options, and medications. Let's first take a look at diet and exercise. Society in general is not helping us win this battle. With the growing number of processed foods, refined flours and sugars, and the perception that we need to supersize our portions, America is getting fatter by the second. Something as simple as eating healthier and more organic foods, vegetables, and fruits can make a significant difference. Diet and exercise is the best way to fight obesity and being overweight. We need to do away with the common misbelief that we should eat 3 squares a day. Eating anywhere from 4 to 6 smaller portions of food will help speed up your metabolism, which will cause your body to change your food into energy quicker, aiding in the fat burning process. You may ask why it is important to exercise if eating healthier is enough to lose weight or stop from becoming overweight. The answer is because exercise brings on other important benefits such as better mental health, muscular conditioning, and improved cardiovascular health. Plus, it helps speed up weight loss if you add a regular exercise routine to your diet. Some people try several different types of exercise programs and diets for years and are still unable to lose a significant amount of weight. Over 14,500 people have had obesity surgery according to the International Bariatric Surgery Registry. Surgery is an option that should only be considered by those who are severely obese and have not been successful with diet and exercise. People who have had this surgery have experienced rapid weight loss and continue to do so for a period of 12 to 18 months. Patients may experience a loss of up to 50% of their excess weight in the first 6 months after their surgery and may experience up to 77% in the first year. But there are risks involved with having the surgery. Some complications with the surgery have resulted in prolonged hospital stays of 7 days or more, and in 10 to 20%, patients have needed to come back for follow-up operations to correct obesity surgery complications. All of these statistics come from the Endocrine Society. Because of their known complications that can result from the surgery, most professionals in the medical career field recommend diet and exercise, with surgery being a last resort along with medication. There are several types of weight loss drugs on the market that are FDA approved. If you decide to use a medication to treat obesity, make sure you do so under the care of a physician. Understand that medication is not the solve-all. It will work most effectively when combined with dietary and lifestyle modifications. There are 2 types of drugs approved by the FDA that are for long-term and short-term use. The long-term obesity treatments are those that suppress one's appetite, and the short-term are those that burn fat in a shorter period of time. But absolutely must be combined with diet and exercise. Anyone who has chronic conditions such as heart diseases, high blood pressure, or thyroid conditions should steer clear of any weight loss medications. This should be low on the list of treatment options for obesity. Dr. Baer advises people to emphasize caution when using these medications. He goes on record supporting diet and exercise, and while he believes some of these medications could benefit in weight loss, he rarely prescribes them. I've presented to you several different ways to prevent and treat obesity. However, I kept going back to the most recommended by medical professionals worldwide, diet and exercise. It is important that we take our health back from the fast food conglomerates and all the processed food on the shelves of our local grocery stores. America is quickly becoming a society ruled by reality television shows and video games. No one goes out anymore and gets involved in a sport or outdoor activities. We need to put the life back in Americans across the country who have become couch potatoes. Being healthy and fit does not only have its medical advantages, but it can lead to a happier and more eventful life. There are thousands of Americans out there who are so overweight that they cannot do something as simple as go out in the yard and play catch with their child. You have to ask yourself, do you want to be one of those people, or do you want to be someone who can take part in every aspect of their youth?